Hey, habari za kushinda. Tuko hapa Hill Park Hotel, naitwa GB Gathui, show inaitwa Doctor's Practice. So ni ile kipindi ambayo tunaleta professionals from the different facets of the health industry. Tunawa engage waweze kujibu maswali zile mnatuliza kuhusu insurance, care, nutrition, na mgeni wetu wa leo pia ni Dr. Wanjohi ama Wanjohi, so from a doctor's perspective. So hao wote ndio tuweze kuelewa umuhimu ama anything, maswali yote ambayo tuko nayo ama issues ambayo tuko nazo kuhusu health. So topic ya leo ni interesting. Si ati hizo zingine zikuwa, hii ni interesting. Sexual and reproductive health. So ndio tuweze kuelewa hizo major issues kuhusu reproductive health. Tuanze tu na scope. In fact, since you ndio mgeni wetu leo, mmempatia chai, umemwekea sukari poa? Okay. Tuweze kwanza na daktari na ile swali muhimu. Ni issue ya kina mama peke yake?
Asante sana Jimmy kwa kunihave kwa issue.
Karibu na uko sharp sana.
Asante.
Uko smart sana.
Sasa scope ya reproductive health ama tuseme in short SRH.
Hiyo
inashika wase wote.
Women and men.
Women and men and all age groups. Kwa sababu tukiingia issues za reproductive health zianza wakati msee amezaliwa, mpaka akizeeka, si ndio? Mpaka akiwa buda, akiwa grandfather, zote ataingia kwa hiyo line.
Yes, sexual and reproductive health.
Yes. Kitu ingine ni kujua kwamba a lot of health issues will have a reproductive aspect. Tuseme kama siku hizi tunaongea about non-communicable diseases.
Yes.
Sasa kama madawa nyingi kama zile za pressure zita affect libido, tuseme kwa married couples. So utapata a lot of the time si ndio tutapata hizo dawa ndio zina kuaffect ama ndio hizi ndio uta avoid. So it's actually cross cutting and it involves everybody. So there's a lot of scope for everybody to chip in.
So different stages, different experiences in terms of sexual and reproductive health.
Yes.
So the impact of reproductive health in terms of insurance, in what is covered, how wide is it cover?
Wow.
Nani given? Wow. Products ambazo direct
wow. Sasa hii topic, by the way, it can be a little bit controversial because ninaanza hivi. First of all, reproductive health or that leads to maternity is not really considered an insurable risk for starters. Huh? But yes, so there's the issue of infertility, which of course is a challenge within your body system and cannot be, you cannot either project it or you cannot plan for it. It's just something that happens. But it does have quite a clear impact on insurance in the sense that, first of all, the costs za reproductive health, sexual and reproductive health are quite high. Ukiangalia mtu mwenye ako infertile, for instance, kuna quite a lot of tests that must be done to determine the degree and the extent of which this infertility. Infertility wananchi ni kutoweza kupata mtoto. Na inaweza kuwa ni bibi ama bwana. So
si bibi peke yake.
Si bibi peke yake. Unajua ni hao wahenga ndo walikuwa wana blame bibi immediately. Lakini of course with the science and technology tumejua. So yes, nina look forward to explain the implications cost-wise kwa sexual reproductive health from the point of trying to get pregnant to the whole process of pregnancy. Pia kuna costs fulani, hizo scans na tests na kila kitu. Alafu of course the delivery. Alafu ndo tuna pass this now costs to the pediatrics etc. Baada ya mtoto amezaliwa. So yes, there's quite a big impact through that whole journey. Na iko na quite some serious implications which nitaongelelea kwa hii episode leo.
Well done.
Yeah.
Karo.
Yes.
Different types or zile common reproductive health issues ambazo sha handle ambazo ziko common sumbua.
I think I want to get back to what Adelaide was saying in regards to infertility. Kwamba in the African context ni kwamba infertility is only a woman issue. Yet we know very well a third is actually the man's issue, a third is the woman, and in general it's both of them.
Okay.
Yes, so again, wewe kama mwanamke ambaye haujaweza kuzaa ni shida sana in the African culture. Because utaambiwa sasa bwana yako atafute bibi wa pili.
Manake wewe
kwa sababu wewe umeshindwa kuleta kijamii ambaye inafaa kuendelea. So reproductive health is such a serious thing that we need to discuss. Yet sometimes we are so we hide ourselves under the sun because we don't want to mention the things that are there. But as we've said, and maybe what Felix was bringing in regards to libido and all that, the man could be having an issue with the sperm count, yeah, or sperm motility. There could be issues with the dysfunctional penis, or even, you know, the sexual organs.
Right.
For the woman, she could also be having issues with menstruation. Maybe she's not able to conceive because of menstruation issues. Maybe she's also not ovulating, yeah? We could also have issues with the reproductive system in itself, whereby maybe someone has cancer, there was another infection, for example, a pelvic inflammatory disease, whereby the tubes are already blocked. So those are some of the serious issues that are there that sometimes we want to hide them, yet they are very common and they're there.
You know, story ni ndefu. Yeah, that's why kuna hiyo part 1 but tunasukuma 20 minutes.
Yes.
Au kuongea story ya nutrition.
Most of the body reaction depends on much on the hormonal, because it's the hormone that will signalize the brain, and it leads to that erection. So women, we have the progesterone, and male the progesterone, if I'm right. So this hormone,
anakusikiza.
Kuna testosterone and then kuna
testosterone.
Estrogen and progesterone for ladies and
yes.
testosterone for men.
Great. So you get like the testosterone hormone to be produced. It requires some nutrients, and one of them is zinc.
Zinc.
That help in testosterone hormone production. Apart from that, there are so many more. Then you get, now one thing, there is an hormone called citrulline. It's a protein in the body. Now citrulline comes from natural food, such as unapata vitu kama, okay, the Latin name of citrulline inaitwa citrullus. So citrullus inamaanisha watermelon in Latin. So watermelon help in production of citrulline. Now citrulline help in production of kitu inaitwa arginine. Now arginine naturally in food inatoka vitu kama sasa unaona hizo njugu, flaxseed, chia seeds, and those are the same thing that helps also in balancing progesterone and progesterone. Unaelewa? So arginine now will help in production kitu inaitwa, it helps in transforming kitu inaitwa nitrates. Now nitrates inatoka kama spinach, ndio maana unapata mtu anaenda pale tao anachukua juice iko na spinach, iko na imewekwa kanjugu pale inaitwa ujipawa ama ujipawa. Vitu kama hiyo. So nitrates arginine sasa ina transform nitrates to kitu inaitwa nitric oxide. Now most of this dawa unapata the help in side effects are hypertension, ndio pressure reduce blood flow. Na apart from that, yes, unaweza kuwa na testosterone hormone imetolewa vizuri, si ndio? Na zinc and everything. But unapata sperm count yako iko chini. So zinc helps also in fertilization and maturity of the sperm. So it's much of nutrition, and also supplements also comes in. I don't know if I talk of it now or later.
Wacha tuchukue break hey, unaona vile kitu ni kubwa.
Natural sources are zinc.
Okay. So unajua ile kitu embarrassing ni hiyo kuadmit ama kusema mimi nenda kuangalia kwa nini. Hiyo embarrassment kwanza ya mwanaume. Wow, nishaisikia. And many more to come tukirudi. Endo chukue chai urudi. Tutatupata hapa.